It was a typical Thursday evening when my phone rang. On the other end, Carlos, my brother-in-law, spoke with an agitated voice. "Anna, please, can you come to the hospital? João is very unwell. They admitted him to the ICU, and I don't understand anything the doctors are saying." João was my older brother, 52 years old, and had been diabetic for a decade. Carlos was in a complete panic. I grabbed my bag and rushed to Hospital Municipal São José, on the other side of the city. I arrived at 9:30 p.m. wearing jeans, sneakers, and a simple blouse. My hair was tied back in a messy ponytail after a long day of surgeries at my own hospital. Nothing in my appearance indicated that I was Dr. Ana Beatriz Mendonça, a cardiovascular surgeon with 15 years of experience. At the ICU reception, Carlos was waiting for me, visibly shaken. "They said it's serious, Anna. Something about diabetic ketoacidosis." I didn't quite understand. I took his hand to reassure him. "Let's see João first, then we'll talk." The on-call doctor, Dr. Mauricio, a young man who looked about 28, met us in the hallway. He addressed Carlos exclusively. "Sir, your brother's condition is complicated. The tests show severe diabetic ketoacidosis with signs of cardiovascular decompensation." I tried to interject. "Doctor, can I see the test results?" He looked at me impatiently. "I understand your concern, but I need to speak with the responsible family member." He turned back to Carlos. "As I was saying, we're going to need to intubate your brother." "Excuse me," I insisted, "but I'd like to understand the full picture better. What's the current pH? And the potassium levels?" Dr. Mauricio sighed audibly. That information is technical. The lay family doesn't need to worry about medical details. The important thing is for you to authorize the procedure." Carlos, nervous, pulled me aside. "Anna, let the doctor do his job. You're getting in the way." I took a deep breath. In normal situations, I would have introduced myself as a colleague, but something in that young doctor's arrogant demeanor bothered me. I decided to observe first. We entered the room. João was conscious but clearly weakened. His breathing was rapid, cusmal breathing, typical of ketoacidosis. Discreetly, I checked the monitor. Heart rate 110, blood pressure 90/60ths, saturation 94%. Dr. Mauricio quickly examined João. "We're preparing for intubation. His saturation is dropping." Something wasn't right. I approached the bedside. "João, how are you feeling?" "Tired, Anna. But I'm not short of breath. Just weak." I looked at the monitor again. His saturation was stable at 94%, with no signs of acute respiratory failure. The tachypnea was compensatory for acidosis, not respiratory insufficiency. "Doctor," I called Dr. Mauricio, "I believe intubation might be premature. The patient is metabolically compensating well for the acidosis." He glared at me with irritation. Please, let me do my job. Do not interfere with medical treatment." "But doctor, observe that he has no signs of respiratory fatigue. His saturation is stable, with no use of accessory muscles." He raised his voice. "Stop interfering. I am the doctor here. The family needs to trust the professional and not create confusion." Carlos looked embarrassed. "Anna, please." At that moment, the monitor began to beep. João's blood pressure plummeted to 70/40ths. He turned pale and started to break out in a cold sweat. Dr. Mauricio became visibly nervous. "Hypovolemic shock. I'll order saline solution." "No!" I instinctively shouted. "He's in ketoacidosis with severe dehydration and probable hyponatremia. Saline solution can worsen the neurological picture. You cannot give medical orders." Dr. Mauricio was agitated. But João was becoming drowsy. His eyes started to roll back. This was an emergency. There was no more time for protocols. I rushed to Dr. Mauricio. "I am Dr. Ana Beatriz Mendonça, a cardiovascular surgeon from Santa Casa Hospital. This patient needs hypoosmolar dextrose solution and gradual electrolyte correction, not fluid expansion with saline." He looked at me in disbelief. You're a doctor. CRM 12.847 SP. And this patient is entering hyperosmolar coma due to severe dehydration with secondary hyponatremia. He needs controlled hydration and gradual glucose correction. The young doctor froze. João was rapidly losing consciousness. I grabbed the internal phone. Hello, pharmacy?
Drana Mendonça here.
I urgently need 5% dextrose solution with 20 MEq of potassium per liter. And regular insulin for infusion pump. I turned back to Dr. Mauricio. His ketoacidosis is respiratorily compensated. The problem is severe dehydration with electrolyte imbalance. If you give him saline now, it could cause cerebral edema. Carlos was bewildered. Anna, do you understand all this? Yes, Carlos, I do. It's my area. Quickly, I calculated the infusion rate. We need to correct the blood glucose slowly, no more than 50 mg per deciliter per hour. And the natremia cannot vary by more than 10 MEq in 24 hours. Dr. Mauricio, still in shock, stammered. But you didn't introduce yourself as a doctor. I tried to discuss the case technically. You interrupted me by saying that a lay family doesn't need to understand. We began controlled hydration. Within 20 minutes, João's blood pressure stabilized. In an hour, he was conscious and talking normally. Dr. Mauricio approached me, clearly embarrassed. Dr. Anna, I apologize. I shouldn't have assumed you were just an accompanying family member. Doctor, the problem wasn't assuming. It was not listening. Even if I were just his sister, my observations about his clinical state were valid. You are right. I let presumption get the better of me. Carlos was still processing everything. Anna, did you literally save João's life? We saved him together. Dr. Mauricio executed the treatment perfectly after we discussed the case. João, now more alert, held my hand. Thank you, little sister. I always knew having a doctor in the family would come in handy someday. Dr. Mauricio asked to speak with me privately. Dr. Anna, I learned an important lesson today. I promise I will never again dismiss an opinion because of the appearance or social standing of the person speaking. That's what matters. Medicine isn't about ego, it's about the patient. 3 days later, João was discharged, fully recovered. Dr. Mauricio made a point of accompanying us to the exit. Dr. Anna, can I ask you a question? Why didn't you introduce yourself as a doctor from the start? I thought for a moment. You know, Mauricio, sometimes it's good to observe how things work when we think no one is watching. I learned a lot about medical communication that night. And I learned about humility, he replied. Thank you for teaching me without humiliating me. Months later, Dr. Mauricio sought me out for a cardiovascular surgery internship. Today, he is one of the most respectful and thorough residents I know. That night taught me that medical knowledge can come from anywhere, and that listening is always more important than presuming. Sometimes, the person we least expect might have exactly the answer we need.